Neonatal hypoglycemia. Neonatal hypoglycemia is defined when the plasma glucose level is less than 30 mg per deciliter in the first 24 hours of life and less than 45 mg per deciliter, 2.5 millimoles per liter, afterward. Risk factors of neonatal hypoglycemia. Clinical features. Treatment. Symptomatic. IV 10% dextrose at 2 ml per kilogram stat bolus and then continuous IV fluids at a glucose infusion rate of 6 mg per kilogram per minute and then monitor blood glucose and titrate GIR according to blood glucose value. GIR equals glucose infusion rate. Asymptomatic.